Hello, doctors. Welcome to DC Conversations. First of all, happy Doctors' Day to both of you.
Thank you.
I know, I mean, enough has been said about all these things, and also, I mean, no matter how much we try to thank you, I don't think that words are not enough, actually. So, thank you for all the services you people do endlessly and selflessly. We are so grateful to you for that. Thank you so much, and happy
Awesome.
Doctors' Day.
Thank you for your kind words.
I thought, instead of discussing the usual, disease-related things, today I think it would be great to talk about the human side of you, basically. How is your life like on a daily basis?
As a part of being a doctor, I think the most difficult and a challenging situation is when when you know that the patient has a problem and you tell them what is the problem, but then there is an intellectual gap between what you want to say and what the patient understands. To be honest, I tell them everything that this procedure needs to be done and this is the result. But of course, there is a risk of complication. But if you think in a logical way, that complication is not very high. But still, the patient, even though being at the verge of losing the neurology and being at the risk of the bad effects of a disease, they somehow have a fear that I don't know how. I really don't know how to put it, but somehow I find it difficult to explain to them that it is worth taking the risk and then moving to a better life rather than just avoiding a surgery because so many things, you hear a lot of things around in the world, and and they just believe the rumors without actually knowing the true story. So this is something I have faced a lot in the spinal practice, because spine surgery is actually going around the nerves and everything, and people do fear of it a lot. Even though we are giving good results, patients are getting walking in next day, they're happy with their lives, but still it becomes quite challenging in certain grade of patients to get the message through.
Yeah, so as I was saying earlier, the greatest issue that we face is when patients come with a neurosurgical issue, and the set idea, which even Dr. Nikhil said, is they feel that any neurosurgical issue is probably a dead end for them, and how to take it from there. There's a lot of misconceptions which come in, and uh, they tend to lose hope. Lesions like brain tumors, which are highly malignant, of course, have a bad prognosis, but they come with so many expectations that it's difficult to kind of fulfill all of it with the kind of outcomes that these kind of pathologies have, and also to kind of balance it with the finances which the patients have.
Yeah.
Many of the neurological issues, spinal issues are chronic issues, and it's not like a one-stop solution where you treat it, send them home within 5 days, and then it's done. They need a lot of follow-up. They need a lot of ancillary support and care, which many a times either the families or their finances do not cannot afford. Balance everything in an Indian scenario and offer the best that you can do is a challenge at times. Yeah.
Also, you must be, dealing with a lot of critical cases on a daily basis, right? That kind of takes an emotional toll on your health also. So, how do you tackle that kind of scenario? I mean, how do you deal with it on a daily basis?
So for me, I think my wife has been the biggest support. She is also a doctor. She's a psychiatrist, but she stays back home. She takes care of my family, my parents, and my. I mean, she's working, but she somehow she manages to pull everything emotionally together. So I think that is the best thing I've got. That is because I'm working. I wake up 5 o'clock in the morning, and when I go back to bed, it's almost 10:30, 11. So I struggle to manage things when it includes the housework and the professional duties, and sometimes you get calls out of somewhere. Suddenly you need to be present at a place. So my wife has been a very very good support for me, and I think she keeps me going. So I find some peace. I can leave things to her and just focus on what I want to do.
mean, many people ask me, like, what is the best investment that you have? The best investment that I have is my family. And especially as I'm also fortunate to have my wife as a doctor, and she's a dermatologist, so she can afford more time with my family, balance everything, her work, the family, take care of the internet emotional needs. Sometimes you tend to have patients who are kind of not going the way you plan, or come to you in a very critical state, absorb everything like a sponge, and you tend to kind of work on it, think of it in your mind. But over a period of time, you know that you kind of rationalize and say that you've done the best for the patient. And that's the best that anyone could have given at any point in time, including ourselves. So that's one way of looking at it. And then otherwise, probably switching off on weekends if you're not on call, kind of having hobbies, going out for a drive, relaxing with movies or music, reading, writing. These are some ways where you can um, kind of dilute your burden, your stress that way. Yes.
You feel any kind of guilt at some point, like maybe you wanted to spend more time with your family, watch your kids grow up, be part of their milestones?
Absolutely. Yeah. I mean, um, sometimes you've missed out on their growing years and you feel, I mean, I could have actually spent more time with them. And at some time, my children are still studying, but probably 10 years from now, when they are in a outside university or a place away from home, and when everything feels kind of empty at home, I think that's when it would set in. Yes.
So my son is very young. So because Sir is quite senior to me. So my son is only 7 years old. So I don't have a long list of milestones so far. But yeah, I do understand that there are times when he wants to play and I'm tired and or sometimes I'm busy. So I have so so I try to like I made it a rule that I will always try to play badminton within every Saturday evening, and every Sunday morning we go for swimming. And if on Sunday evening it is possible, we try to play again. So these are some things I try, but yeah, but of course there are days it's a bit difficult to predict what will happen. But I keep trying. So.
You see a lot of cases, but has there been a particularly tough case that actually affected you personally?
Think so. I think every case has been a learning for me. But yeah, I think that was something like 3, 4 years, I think 4 or 5 years ago when there was a patient who had a cervical spine infection, and and I think he was almost bedbound. And we tried to do the best. We tried to remove the infection, but we could not help him. But yeah, so and the guy had put in a lot of money. I think he didn't have any medical insurance, and he had come from not he was not from Delhi. He was from a tier 2 city, and he was hoping to get the things done, but and he spent a lot of money. It was a corporate hospital I was working in, but then, even though we tried, but we did our best, but then definitely we didn't get the results which we thought we could, and the patient could not recover. So yeah, those kind of cases do haunt us, especially when we see patients spending a lot of money out of their pocket, their family coming together, trying to arrange all the money they need, but what maximum we can do is what professionally I know what I have learned. It keeps reminding that of course there are things beyond my control, and I can only talk like a professional. I can tell the patient that this is what I can do, this is possible. So yeah, those situations are tough where they pin a lot of hopes on you, and then you are not able to deliver what they wanted. So.
One case which I particularly remember, which was challenging, is a child who was attaining puberty, and it was found that she had a rare bleeding disorder at that time. Maybe it wasn't picked up early, or they were counseled that she had this bleeding disorder, which they haven't treated appropriately with the injections that were needed. So this child, who was around 12, presented with a bleed in the brain, and they brought the patient to us as a tertiary referral center. She had a bleeding disorder to a rare factor 13 deficiency, and she had a large bleed. She was comatose, and the family was distraught. That was a girl child, and as I told you, she just attained her puberty. And we tried our best. I managed to save her. We managed to get a lot of factors in the form of cryoprecipitates to control the bleeding by injecting them through the veins. Though the costly factors which are available in the Western countries are not available as yet, we managed somehow to get the factors through blood donation, kind of filtering them through the plasma. And we took her for an emergent surgery with a lot of risk. The chances when you have this kind of a bleed, there's always a risk of not controlling the bleeding when you open the skull to drain the blood. So we managed to drain it, and right now she's in her degree. She's doing well in that way. So you have some trials and you have a lot of tribulations. Sometimes you operate on children with fluid-filled cavities in the brain called hydrocephalus. And suddenly, after 15, 20 years, their parents bring them to you and say, this child was operated by your team nearly 15 years ago, and right now he's joining engineering. So you feel happy that way. And at the
Yeah.
same time, you try your best. Some patients who you expect to do well due to some other issues, maybe their body, their reaction, the kind of comorbid conditions that they have, they end up playing a trick on you. So,
Like I said earlier too, it kind of affects you mentally, right? Because after a case, a very critical case or something like that. So what kind of self-care practices do you prioritize to protect your mental health?
Stay away from television. We don't have a television in the house. If I need a news, we go on the social media, and of course, WhatsApp is there. And I think it's mainly I look for peace. I'm not a party guy. I try to stay more at home, and whatever time I get, I try to spend with my family. So that helps me unwind.
that's pretty much what I would also have said. I wake up probably around 6:30, then I do a half an hour workout every morning, and then avoid parties on weekdays. I don't smoke. And then once a month, I visit my hometown, spend the weekend there, kind of relax, recharge myself, and then come back on Monday. So I feel taking breaks, especially once a month, to detox, and on weekends, otherwise, spend time with your family, friends, go out, drive around, read, write if you can. I mean, these are ways which would probably help you have a um, good health for yourself. Yeah.
Doctors usually treat every case as their first case and give it their all, right? Make sure that they succeed in the case. But sometimes things go south, and you it is beyond your control, like Dr. Nikhil said. So when that happens, and also for the family, also life is very valuable. So they kind of come to you. They're angry with you. They're upset. They have different kinds of emotions that they exhibit. How do you deal with such a situation?
I think so. I've learned this somehow through. I think I used to. So a few years back, I joined practice uh, Buddhism. Uh, teachings. I started learning about them, and then they told me that I think you see the things that they are. So I just it's like whatever it is, it is. I cannot change anything. My perception cannot change it. My attitude cannot change it. If somebody has lost a life, he has lost it. Even if I cry, I can't bring him back. So I just try to be honest. I tell them what I did. I explain to the relatives. I tried. I tell them honestly, and then I just accept what their emotions are. There are times when they're angry. They do act rude, but then of course they have had a major loss, and so I just observe them. I think just observing them and being honest and telling what you tried, and just wait. That is what I have done in the past, and I think I will continue to do in the future because yeah, so that is the only way you can just see how the things are. So
I mean, like was just said, you have to be honest with the outcomes with the patient, whichever way they go. And the more honest you are, the more forthright, and the patient would like, if a person who is been taking care of the patient comes and speaks directly to the relatives, that's half the battle which is won, rather than having a hostile relative. Of course, you should put yourself in their shoes, because there's something which has happened adverse to what they had thought would happen, or maybe the expectations were pretty high even in a very critical case. So that way, do not lose your cool. Do not counter argue with them when, however irrational they may be. The more cool and calm you are with what they are saying, they would probably come down at some point in time. Everybody goes through emotions. There are 5 different stages of emotions. Everybody goes through them. We also go through them. So just be honest, be calm, have a soft argue with them. And then if you are truthful to what you've done and what you've said to them, then obviously things will fall in place.
One last question. What's your message on Doctor's Day?
we just want to say that I would like to say is that we are professionals. Patients do come to us with high expectations, but they should understand that we have learned a technique and we have a skill that we are trying to use. So we try to do our best, but definitely we can't decide everything in the world. And yeah, and doctors do have lives. I would request the patients to stop connecting me on some weekends at least, for with the phone calls and messages. So that will be great for me.
Yeah, that's very well said. I mean, what patients and everyone else and their relatives should understand is that, after all, we too are humans. We have our families, we have our lives, and we are not magicians or God. We try to do our best in whatever way which we can to help the patient, and we too fall sick. We are humans, as I've just said. So we have families, we too have illnesses, we too fall sick. So we are in the same boat, in the same journey, and we try to make everybody's life more healthier and less painful with what we can do. Yeah.
Thank you so much for your time, and thank you for talking to us.
Thank you so much. Thank you for having me.
Thanks,
Thank you.
Ashwini.
Have a
Thanks,
lovely day.
Ashwini.